Okay, guys, I'm back here with another report on my total right knee operation. I'm following up. This is exactly 3 weeks from my operation, so it's now the 29th of December, and I had my operation the 8th of December. And I'm feeling pretty good. As far as range of motion and pain and moving along as far as functionality, I'm doing very well. I did do a video 2 weeks out, but when I downloaded it, the sound quality was very poor. So I'm going to see if I can correct that and then get it downloaded so you get an interim report in the middle of this. Right now, I think the main problem that I got is not pain or functionality at all. It's basically sleep. I haven't been able to sleep very well. Now that could be because of pain, underlying pain. It might be because of the way I sleep. I've always been a stomach sleeper, so I sleep on my stomach. It's a little bit hard to keep your knee straight and not to cause pain to the knee area when you're sleeping on your stomach. And you can do it on your side and putting pillows in between your legs and things like that. But basically, it's been a struggle. I've been on the struggle bus trying to sleep, and I've gone back and forth from the guest room to the bed, with my wife, and it's just been a struggle on that. I'll tell you, as far as first thing, and I noted that in my first video, the pain medications were very good as far as covering the pain from this particular knee operation, which is a significant insult. One of the downsides, though, of the narcotic pain medication is even though they cover the pain, they do cause the desire to urinate, and if you're an older individual like me, 72, who already gets up a lot during the night to go to the bathroom, it's with the narcotics, taking it as they suggest every 4 hours becomes, you're going to the bathroom all the time. It seems didn't seem to get any better. So what I decided to do was just not take any pain medication during the day, because during the day I don't have any pain. I'm doing things. I'm reading. I'm working on the computer. I'm writing and reading other things. So really, I don't need any pain medications because I'm distracted. At night is when I think I needed it, but it's like I say, it might not have anything to do with pain. It might have more to do with just the fact that I sleep on my stomach and I haven't been able to find a comfortable position to sleep. But right now, today is my best day. I got a little bit over 5 hours of sleep. It was all disjointed, according to my Oura ring, it was disjointed all through the night. But at least it was a 5 hours worth of sleep, a little bit over 5 hours, which is good for me since this operation. So that's been the first problem that I've had. The second problem has not been a significant one as far as pain, movement, and except in the far edges of the range of motion when I'm doing exercises, especially in physical therapy, have only, and it's not been something that's particularly difficult to deal with, even after a good physical therapy session. Now, I mentioned that I started at home, and I did not do any rehab, go to an inside rehab facility after the operation. I had one night in the hospital, and I had one physical therapy session, which was mainly an assessment to see if I can move around okay. And then I had 2 weeks, about a week and a half, 2 weeks of home health care, nurse coming twice a week and a physical therapist coming 3 times a week. And that seemed to work fine for me. You know, initially I was using a walker, but I was walking around without the walker pretty much. And then I graduated to a cane, and I was doing okay with the cane too. And today he said, you know, you need a cane. You're working fine. You're moving fine without the cane. It's a little bit tiring, you know, for walking, you know, a mile, 2 miles. Sometimes that we walk with our dog, and that's so. I kind of use the cane on long walks, but generally speaking, walking around the house or even walking to stores and things like that, I don't have to use anything as of right now. So that's been nice. It's best that you can get away from all that. You don't want to look like an invalid. I have noticed that people on the streets, you know, the cars don't run me over, don't chase me across the street when I've got the cane. So that's one upside on this anyway. So, you know, now as far as exercises, the initial exercises were mainly bed exercises that you did in the bed, and then you know, lifting the legs up and the like, and then so at home you could do them, and also sitting in a chair, moving your leg back as far as you could, and then straightening it out. And then I graduated to working around on the counter, kitchen counter, moving your legs back and forth. I was given a number of exercises before the operation, which I tried to incorporate, but not too much, because sometimes if you go too fast, you'll start getting too much pain, and I was scared of injuring something. I don't think that's really possible, but I tried to avoid. I think with my particular problems, you know, it's more pushing too hard after. So I'm taking it easy, I'm resting, I'm icing it out. I told you about the ice machine that they sent home from the hospital. Very good machine. It circulates very cold water that has ice in it, and you just plug it in, and it has the water circulating in a kind of a globe that surrounds the knee. That's not porous, you know, but the cold can get around the knee, and that's been pretty effective in icing, as far as doing icing. As I indicated, I don't take pain medications during the day. I don't think I need it. At night, I tried experimenting, and nothing seems to help me. I don't know if there's anything to do with pain at all, but anyway, the exercises, since I've been at the outpatient physical therapy, and I've done that, I've had 3 sessions now. So I've had 1 session 2 weeks out, and then a session on Thursday, and then a session today. And it's better in the outpatient setting because they've got equipment that you can use, and they can show you the correct way to do a lot of the exercises, and then I can play with those a little bit at home, because I've got a lot of room down in the basement that I can work with. I have got an exercise bike, so you know, I'm putting that together this weekend, and I did about 10 minutes on the exercise bike at the physical therapy office at the end of my session today, and it seemed to work pretty well. So far it's been a very nice process, except for the sleep, which has been difficult to deal with. But yeah, I think it helped to have a nice explanation that the surgeon had, and the surgeon's office sent out. It not only looked at a film which told you what to expect during the operation, but they had post-op instructions, they had a phone number to call if you needed additional pain medications, and so it kind of reduced a lot of the anxiety. And that's what I like to do for you. I think the biggest thing in these type of things is when you get under, when you need healing, is you're afraid. You're hurting. You're thinking that you're not going to recover very well, or you're not doing everything you can, or you're not going to be able to sleep for the rest of your life, or something like that. Don't worry about it. You just got to wait your time and work through it. And I think that's one of the best things that I can offer you right now. It'll all work out in the end. It's a very well recorded procedure. The people do it very well. They recover like 98%, feel very, very much better. And I can tell you that much. It has not been a fearful experience. I always try and link this video into something from the Course in Miracles. And I've got a little lesson here. Healing, this is from the text. Healing as release from fear. And this is from the Course in Miracles, chapter 4. Our emphasis is now on healing. The miracle is the means, atonement is the principle, and healing is the result. To speak of a miracle of healing is to combine two orders of reality inappropriately. Healing is not a miracle. The atonement, or the final miracle, is a remedy, and any type of healing is the result. The kind of error to which the atonement is applied is irrelevant. All healing is essentially a release from fear. To undertake this, you cannot be fearful yourself. You do not understand healing because of your own fear. So, basically, what they're saying in the Course is fear is the biggest problem that you have to deal with in any kind of sickness or discomfort of any kind. It's the fear that you have. I'm reading a book, Eric Larson, about Churchill in 1940. Churchill, when they were attacking, Hitler was attacking London particularly, and trying to finish off all of Europe before he turned against Russia. And it's a very good book, and it talks about the fear that was engendered by the attacks and the dive bombings and the like, and people not being able to sleep. And it's very similar experience to what I'm experiencing in my knee operation. But if you approach it without the fear, if you approach it with a feeling where you know this is going to go away, it's going to work its way through, I think that's the best way to approach it. Kind of the same way that we've had with our own pandemic this year, and how things have gone during the pandemic, and you think, is this ever going to end? It's just ever going to end. And I think finally we're coming to a place where we could see the light at the end of the tunnel. And let's not be afraid. Let's understand that this is time limited, that we're going to have a good result of this after all. And so I'm not saying how you should approach it. All I'm saying is you should approach it not with fear. And that was largely how Churchill approached it, and largely how the people of London interpreted that. And I think it made it a lot better, and it made it a lot easier for them to work through that particular phase of World War II. So anyway, that's what I got to say now. Thank you very much, and I'll get back to you hopefully week 4 on this, on my